Welcome to the Kvara podcast. I'm Dr. Kevin Carnevale. I'm an OBGYN in Southern California. And in this podcast, we're going to meet with a slew of guests talking about various topics in the postpartum period, commonly referred to as the fourth trimester. Stay tuned for today's episode. Hey everybody, welcome back to another episode of the Kvara podcast. Again, for those of you joining for the first time, I'm Dr. Carnevale. I'm an OBGYN in Southern California, and we have a very special guest today. This is Kristen Essick. Kristen, welcome. Thank you for joining.
Thank you so much, Dr. Carnevale, and thank you for having me. My name is Kristen Essick, and I'm an IBCLC lactation consultant and a certified doula.
Awesome. Again, thank you for taking the time to be here today. What we're really going to focus on today's topic is actually the breastfeeding side of things, the lactation consultant hat that you wear, which is a really important piece, and I think is something missing from a lot of postpartum care. You know, unfortunately, as many of you know out there, and you and I certainly know, patients have very limited interaction with a lactation consultant, which is, I think, and I'm sure you agree, is one of the most important things in postpartum care.
It really is.
Yeah. So we're here to talk about, kind of pick your brain as to your expertise and kind of, give people out there, hopefully some, tips and at-home hacks and kind of how to get through that period, especially for first-time moms.
Absolutely.
There are so many benefits to breastfeeding. So many, both for baby and for mom.
Yes.
Would you mind just kind of touching on each of those? We'll start with mom.
Okay.
What are the benefits of breastfeeding for mom?
So breastfeeding has so many benefits, like you're already stating. As far as for moms that are breastfeeding are going to have a lower incidence of breast cancer and ovarian cancer.
Absolutely.
And that reward is cumulative, meaning that the more babies a mother breastfeeds and the longer that a mother breastfeeds for, the more the benefit and reduction in risk is.
Absolutely.
Additionally, which is really fascinating to me, is by breastfeeding, a mother reduces her risk of having diabetes type 2. So that's pretty interesting. So any metabolic disease, it helps reduce in mothers their risk of cardiac disease. So also fascinating, osteoporosis as well. It helps return to their pre-pregnancy body much quicker as well.
It certainly does.
For some moms, depending on how old the baby is in the scenario, it may delay the return of fertility for them, meaning child spacing. So that's a really important thing to consider. And then in light of the current history of what's going on in like Georgia, breastfeeding provides food security for a family. Breast milk and breastfeeding specifically during an emergency is extremely valuable, and it's safer for mom and baby in that way.
It's safer for mom and baby. It's so much better than formula.
Yeah.
It's so much better for the babies, and obviously all the benefits for mom. I joke with in residency and coming up, breastfeeding, it's like having built-in Groupons,
Oh, yeah.
Yeah, you're saving money.
Yeah.
You can feed your baby. It's super, super helpful.
Yeah.
But those are all really important benefits for mom for breastfeeding. The diminishing your chance of breast cancer, ovarian cancer, these are all very real benefits that really aren't widely talked about and not known. So I'm really glad that you discussed those.
Yeah.
Those are enormous benefits for mom. There's certainly benefits for baby. And I know you're going to tell us about those too.
Yes, I am. So breast milk is the optimal food. It's the optimal nutrition for newborn babies in general, absolutely, at any age. And those benefits don't go away just because an infant turns 1 or 2.
Right.
And we can talk more about that later. The benefits for a baby is that it reduces the risk of asthma, metabolic disorder, so diabetes 1, diabetes 2, obesity. When a baby's breastfeeding, they're the ones that are in control of the feed. But when you give a baby formula in a bottle, they're almost obligated to finish the volume. So it reduces the risk of obesity as well. Babies are born with a leaky gut. Breast milk, the colostrum, the first milk, it's actually a sealant. So when a baby is breastfeeding at birth, that colostrum seals the gut. Those open junctions in the baby's gut is going to allow for pathogens, bacteria, allergens to all pass into the bloodstream.
Right.
And so when a baby is exclusively breastfed, that seal is very, very important. And the microbiome is very spoken about lately. And so it sets up the optimal microbiome for the infant for a long period of time.
Right.
And the truth is that one bottle of formula can disrupt that microbiome for several weeks. It will take weeks for a baby's body to go back to its natural biome by just introducing one bottle of formula.
Right. And those are all very real benefits. And
yeah.
then there's even a few more, right? It decreases the risk or likelihood of some childhood cancers like leukemia, which is amazing. Not the most important benefit, but there's some studies that show that babies who breastfeed, especially exclusively breastfeed, have higher IQs.
Yes.
So it's really an all-around benefit, and it's really, really important. Now, what is, every mother's journey and baby's journey is going to be a little bit different, right? Whether mom has to go back to work and there's certain hurdles that they have to get over. What's the optimal time? If a mother was in a vacuum, what's the optimal time for breastfeeding, or optimal length of time?
The CDC, the Centers for Disease Control, the World Health Organization, the American Academy of Pediatrics, and the American College of Gynecology, they all recommend exclusive breastfeeding for the first 6 months and beyond, as long as mutually agreeable with complementary foods. Like I previously said, the benefits of breastfeeding don't go away. They're always present. You're always protecting your baby. With breast milk, the breast milk takes on antibodies for anything that mom has maybe been exposed to, and then they transfer to baby. So if mom is exposed to flu or any other, diseases, then she may be producing antibodies in her milk and providing those to her baby. So breast milk is like a vaccination.
It is, exactly. All of the antibodies we build, and I'm glad you mentioned that, all of the antibodies we build, moms pass it through the breast milk in what's called passive immunity. So it is like a
passive immunity.
It is like it's essentially like the baby's getting a vaccine, but kind of doing it naturally. Mom just passes off her immunity. So it's super, super awesome there. Medicine in general is not like one for all, right?
Right.
It is really important. 6 months exclusive breastfeeding is ideal. That's what we really encourage. And that's in an ideal situation. If your pediatrician or something recommends, you have to supplement. It's important to listen to your provider and work together, but breastfeeding really is ideal. And that's really that's the goal. We're going to talk a little bit about colostrum, and I just want you to kind of reiterate the importance of that, because so many times one of the things I hear in the hospital and even immediately after, I don't feel like my baby's getting enough. My baby's not full, or my milk hasn't come in yet. Please tell the importance of that calorie dense colostrum there.
Yes. It's one of the biggest statements by new moms is perceived insufficient milk in the beginning of, lactation. And in the first couple of days, it's normal to feel like there's not a lot of milk there. What you have, what a parent has is colostrum, and colostrum is highly dense nutrition. It's high in protein and it's higher in carbohydrates as well. And it provides immunity. And again, it coats that gut. A parent is going to collect colostrum antenatally or in the late stages of pregnancy in order to have a little bit of milk on hand after baby's born. So for instance, for a mom with gestational diabetes, they can sometimes have delayed milk onset, which means their mature milk takes a little bit longer to come in. And so having that kind of like backup plan of a little bit of collected colostrum, it really eliminates the potential for supplementation with formula. So any supplementation is best if it's mother's own milk. And so that colostrum, if it's collected in advance, gives them a little bit of a cushion so they don't have to use formula. And in other instances, maybe baby's a little premature, then they have a little bit of milk already. Because as we already kind of talked in the beginning, a mother's not going to produce copious amounts of milk. And so if there's any reason that the newborn needs to be separated from the mother, then they have a little bit of a backup with the colostrum that they collected.
Right, exactly. And I think what you're referring to is, we kind of touched on it prior to this, but there was one study that was done. It was actually gestational diabetics, moms with diabetes during pregnancy, and they actually, pumped late third trimester, towards the end of the pregnancy while you're still pregnant, pumping. The goal was to use that milk, like you mentioned. Some gestational diabetics, are late to produce milk, or even the idea was to use that milk or the colostrum to benefit the babies born to gestational diabetic mothers who sometimes have low blood sugar after birth. So there's a study done there. I think there was some hopes that maybe there would be more milk production. It didn't necessarily show that, but there were some benefits that it did show, which it decreased the time in labor. As you're pumping, it releases a hormone called oxytocin, which is the same hormone that is responsible for labor and also bonding. So it's really important. So it decreased the time in labor and actually decreased the C-section rate because it made your cervix more ripe or ready for labor.
Right.
So it was actually a pretty cool study. It had some benefits there, not necessarily for more milk production, but that colostrum is super beneficial. So having that on hand before is maybe not necessarily a bad idea. But again, for that, that's not routinely practiced.
Right.
Talk to your provider. We try to follow current literature, but it is something that did come out. It is in the literature. It is kind of cool. Do your own research,
right.
Talk to your doc, talk to your lactation consultant, midwife,
yes.
what have you. And maybe it works for you. Again, nothing is for everybody. Maybe it works for you.
Yeah.
Speed bumps to breastfeeding, I hear from moms in the hospital, right, is they feel like their milk is not coming in. They feel like the baby's not full enough, especially those first few days postpartum and when they go home. Babies don't really need as much as they think you do.
Yes.
Right? Go ahead and why don't you talk a little bit about that and why it probably is enough?
Yes. For one, it is one of the most common things that I hear from new moms in the early days is, I just don't have enough milk. People are very visual, and so they like to be able to see, exactly how much food their baby's getting. And that is stemmed maybe from a little bit of insecurity and not entirely trusting their body. But in the early days, a mom produces colostrum. It's produced in a very small amount, about a tablespoon or two in each breast. And it's important to also consider the size of the infant's gut. The belly is only going to hold about 5 to 10 mLs in the early days,
right?
Optimally. Of course, we can get more into the baby, but that's not necessarily what we don't want to do. We don't want to be stuffing a baby full of milk in the early days. Colostrum is very nutrient dense. It's high in protein. It's high in antioxidants. That's why it has its yellow color, commonly referred to as liquid gold. It has a lot of antibodies. And again, it is baby's first vaccination.
Yeah, exactly. At the beginning, a baby's stomach doesn't stretch the same way that ours does, right? And you already mentioned 5 or so cc's, which is like a teaspoon, right? Babies' stomachs are really like the size of a marble or so.
Exactly.
And they don't stretch like ours do. So what you may think or perceive is really not enough, that 5 cc's, think of a marble, you can fill that baby's stomach just fine. And it's very calorie dense.
And I think mom's expectation right after birth is like, woo, I'm going to have that milk supply. Right. And it takes 3 days, sometimes longer, depending on that birth story.
Yeah, it does. Some women are lucky and they get it in right away.
Yeah.
Some it takes some time. Mm-hmm. Now, what are some tips and tricks and things that mom can do to kind of help with that supply? Because we try to encourage them, but sometimes it's a little bit defeating. You think, I'm trying, I'm doing what I can, it's just not working.
Right.
It will work.
Yes.
Eventually it will work.
Yes.
What are those things that you should do and recommend?
So definitely trusting the process. And my first recommendation, anytime I'm going to see a new mom, is skin to skin. Put that baby skin to skin. That means removing baby's clothes down to the diaper, mom's, unclothed from the waist up, and just skin to skin. And sometimes just a matter of 30 minutes and you'll start to see the baby doing the reflexes and the movements that it does to get to where it needs to go.
Right.
The breast, actually, there's glands in the breast called Montgomery glands, and they actually secrete a scent that is similar to amniotic fluid. And so that baby is like, I know that smell.
I smell that, yeah.
And additionally, during pregnancy, mom's areolas are going to get darker and babies just really see contrast. And so we're going to see a baby who's like, ooh, I see a target and I smell that, smell that I'm so familiar with, and they'll kind of make their way down. Now, as far as increasing supply over time, breastfeeding, the mechanism of breastfeeding is a demand supply situation, which means that the more mom breastfeeds, the more that baby removes milk from the breast, the more the body's going to be, I need to make more milk. And so the pituitary tells the breast to make more milk. And then next time the mom feeds, then again, that same process happens. And so it's really a matter of removing milk from the breast that creates that growth and supply.
Right, exactly. Yeah, the more you nurse, the more your brain tells your breast to make milk.
Yes,
right? So
exactly.
It's really important, even if you feel like nothing is coming out or you feel like you're not producing anything.
Exactly.
It's so important, 1, for the bonding, but 2, it actually is working. It is, your pituitary gland is working and is telling your breast to, hey, I need to supply this baby with food. So it does work. It does work. how often, what's the recommendation, should somebody be breastfeeding to, actually stimulate the milk production?
Absolutely. The recommendation is a minimum of 8 to 12 times in 24 hours, and that is baby-led. So we're going to follow baby's cues. But if sometimes in the early days, those newborns are sleepy, depending on the birth story. And so minimally, we want a new parent to, stimulate their infant to feed about every 2 to 3 hours. Now, it's possible that a newborn won't go to breast every 2 to 3 hours, but we definitely want to be offering the breast. Usually by day 2, things have changed. And normally a 2-day-old versus a 24-hour-old or 12-hour-old, their behaviors are going to be just a little bit different.
Right.
And a 2-day-old is going to be a little more hungry and a little more adjusted to having been born. Birth is very overstimulating for babies.
It is, yeah.
And so by day 2, they've adjusted a little bit. And again, like I said, they're a little bit more hungry and they're a little bit more interested in feeding.
Right. Absolutely. And again, I just like to always reiterate, when we do these podcasts, they're really important. They get kind of general information out there, and all of it's factual, all of it's from literature.
Yep.
But again, doesn't work for every patient. And I only mention that because there are a subset of patients that should not breastfeed. There's a certain infections like HIV or some hepatitis infections. So, if your doctor recommends not breastfeeding, please follow those recommendations, because some of those viruses or infections can pass through the breast milk. So it's really important to listen. But outside of those kind of rare circumstances, this is all very true. And I just feel like I have to say that, right?
Yeah.
Just so you say, I watched Kvara and he said I can do it. No. So we talked about the colostrum. We talked about how to help increase milk production. I'd like to hear about, so those are the really common things that we hear about in the hospital and immediately after. What are some other common kind of blockages or issues that mom experience breastfeed that you encounter in your practice?
I feel like first and foremost is a poor understanding about how breastfeeding actually works.
Okay.
And so because they don't understand how it works, they're not necessarily trusting their body. Another one is misinformation. So we're gathering information from sources that aren't reliable or scientific. And so that kind of adds to the potential for insecurity in breastfeeding. Otherwise, latch issues, maybe baby's not latching, maybe it's painful, maybe, sometimes we have family members who want to step in and help, and their help is not exactly positioned in a way that it should be. In other words, let me feed the baby, when realistically what we need to do is support the mother in feeding the baby.
You mentioned latch is one big thing. And we can always put some information at the bottom of this podcast kind of in the feed.
Okay.
But what are some common fixes to some of the latching issues that you encounter in your practice?
Yeah, and latch is really nuanced, because we can look at a latch from the outside and think, oh, well, that looks like a really good latch.
Right.
The lips are where they're supposed to be, right?
Right.
But that's not always the case. As far as fixing a latch, position is always going to be the first thing that I'm going to look at. So we want to make sure that we have maternal support. Is mom comfortable? After that, we want to look at the positioning and alignment of the infant. So we want the ears and the shoulders and the hips in alignment. That puts baby tummy to tummy with mom. We want the nose to line up with the nipple, and that way when baby does latch, there's a little bit of a lift to the chin and there's space between the chin and the chest. Babies have really small necks.
Right.
And a lot of times I'll see babies with their chin just buried into their chest, and that really limits their ability to move their jaw and suckle in the way that they need to suckle.
Right.
So those are the 3 main ways that I would really help with latchings. Positioning is kind of variable from dyad to dyad, meaning mother-baby, couplets.
Right.
So whatever is usually most comfortable for mom. A lot of times we see the baby in the cross cradle, so in the lap, and that's the problem with that one I see is that when a mom is helping a baby latch in the cross cradle position, their hand is over the baby's head and the face, and they really can't see what they're doing. So the most comfortable position for a lot of babies, and it really puts baby in control of the situation, is in a laid back nursing position. And that's when mom is reclined in a chair and baby is like this on the body, tummy to tummy, and that gives the baby the opportunity to kind of do what it needs to do. I also see a lot of moms kind of chasing baby's face with their breast. And so you really want to bring the baby into you and not be trying to chase the baby's mouth with your breast, because that's a moving target for a baby, and that's harder for that baby to latch. So we want to bring the baby in closer to the breast so the baby can do the latching realistically.
Are there a few position names that you can mention so that way our, podcast listeners can go and kind of research and kind of say, oh, that makes total sense?
Yes. So the football position or the clutch position is when the baby's on the side and you're going to have baby's bottom and legs more towards the back of the bed. Okay. This would be more easy to use for a newborn position or for a smaller baby. Once those babies start to get pretty big, it can be harder to position them. I like this position as a learning position because you can, like I said, really see the breast. You can see the baby's face. You can see where everything is in alignment. So that does kind of help with latching. The laid back nursing position, and then the cradle hold is the most common, and it seems to be what most mothers naturally put their baby in that position. So baby's just in the lap, tummy to tummy like that. So I think a key thing to that one is that you make sure that you're supporting the baby and bringing the baby up to the breast, or in some instances you need to support the breast and bring the breast up. For those heavier breasted parents, we want to support that breast and bring it up to the baby.
Okay, perfect. Are there any things that you can buy at one of these stores kind of to help support there, or is it just kind of you can position
buy
changes?
Whatever you want to buy, but pillows typically work.
Just pillows,
pillows typically work. I mean, there's all kinds of products, all kinds of baby pillows, mom pillows, and all that.
Just whatever's comfortable.
Just
for
whatever's
you
comfortable
baby.
For mom and baby, and knowing that you do need support of the baby and of the mom.
Awesome. Now, another thing that will come up in some of my patients, and actually personally, my wife had this issue. For the patients out there that initially, first-time moms, it'll eventually go away, but inverted nipples.
Inverted nipples.
How do you fix this? And what is your recommendation for breastfeeding? Because I know, my wife struggled with this and, felt defeated when she could not get the baby to latch.
Yes.
How do you fix this? And what are your recommendations?
It can be complicated because the suck reflex is where the soft palate meets the hard palate in the mouth. And so with an inverted nipple, it can sometimes be a little more challenging to stimulate that suck in the baby. I personally try not to label them for moms because anything that you say, they just suck it up, and insecurities, will exist. And so I would prefer not to label it, but we can work with it. So I would just continue a skin to skin. There's a hold called the teacup hold, and it's just kind of a little bit of a pinch off to the side of the breast outside the areola that gives the baby a little something to grab onto. Sometimes a little bit of expression of milk to the end of the nipple will help get baby interested in latching, because once they taste the milk, they think, oh, that's definitely what I'm trying to do. Sometimes pumping can work, just kind of pull that nipple out. An inverted nipple is usually caused by what's called a Cooper ligament. The Cooper ligament holds the nipple in place, and when it's tight, it can pull the nipple in a little bit. But it is a ligament, and we can stretch it to some degree. And so a little bit of pumping can help. They have nipple everters on the market. You can buy that too. Like I said, a lot of things that you can buy, but basically pulling out the nipple will help as well. And a lot of times a mother's nipple will kind of come out a little bit more just because the baby's there responsively.
It will get better.
It's always hard in the beginning.
Yeah, for the first time. Then after that, your body remembers what to do. But you mentioned a few things, the teacup hold. Yeah. Right? Or teacup pinch, I think you called it.
Teacup hold,
Yeah, so that's one thing, and then, pumping often eventually, will fix the problem.
Right.
But, it's important to ask, because I wish, this was now, 14 years ago, but I wish something like this was around then, so my poor wife could watch it and say, what the heck am I doing? Kind of figure this out. So we mentioned kind of different common holds and latching issues, the inverted nipples, we won't call it that, but inverted nipples,
That's fine.
Anatomic changes or differences. Yeah. We kind of mentioned how to discuss those. You mentioned there's a lot of misinformation or fake news, if you will. What are the common things that what are the most common things that you hear in your office or in your practice? Kind of myths regarding breastfeeding?
Myths regarding breastfeeding, that it's normal to have pain. It's common, but that's not equivalent to normal. It shouldn't hurt with breastfeeding.
Right.
Any pain is worth a deeper look. That, how big is the baby's stomach? Like, how much does the baby need realistically? Like I said, people are so visual, and feeding is just such a social interaction. And so everybody wants to get their hands on a bottle and feed the baby.
Exactly. Yeah.
Positioning, latch, I think is really one too. Like I said, it's really kind of subjective when you look at a latch and you're like, oh, that looks like a good latch. Baby must be feeding great. Well, there's a little bit more to it. Like, what's going on orally? We need to know that.
Yeah, there's things like tongue ties that
yes,
a pediatrician would have to help the baby with. So you mentioned pain should not be associated with breastfeeding, and I agree completely. It just sparked my memory to think of some other common things, right? You can get some engorgement. That can be a little bit painful. That's not necessarily caused by the breastfeeding per se, the act of breastfeeding, right? So you can get engorgement and mastitis, right? Those are pretty common. So when you mentioned pain, that kind of sparked my memory. What's the difference here, and how does a mom identify the difference between engorgement and mastitis when she should see a provider and get that treated?
Engorgement is that very full feeling of the breast. And initially when mom's, milk comes in, she will have a fullness to her breast. And initially, not all of that is milk. Some of it is actually swelling. And so in the early days, if mom is feeling like she's having engorgement, then we're going to recommend Motrin. It's
inflammatory.
Yes, it's an anti-inflammatory. Additionally, we're going to treat that with cold compresses.
Yeah.
As far as mastitis goes, mastitis is going to be very painful, and it may be unilateral. It may not be in both breasts. Mom with mastitis is going to see some red, some changes in color to the skin.
Exactly.
And with it, engorgement versus mastitis is that a mom with mastitis is potentially going to have a fever, whereas a mom with engorgement isn't going to have a fever.
Yes, you're absolutely right. The differences between engorgement and mastitis, you highlighted perfectly. Engorgement, like you mentioned, is kind of fullness, sometimes inflammation. So as you would imagine, it's bilaterally equal, usually.
True.
Both, a lot of fancy words to say both sides the same, right? It's on both sides. Mastitis, which is a fancy word for infection there in the breast, like you mentioned, it's usually really red. It's usually on one side. It's really red. It's hot to the touch. Almost always it's hot to the touch.
Yeah.
And very often moms have a fever, and that needs to be treated with antibiotics. We usually use like dicloxacillin or some, penicillin derivative is something that we use to treat. Now, a common question that we have, can you breastfeed your baby when they have mastitis?
Absolutely.
Yes,
a mom
please,
has to breastfeed when she has mastitis.
Yes.
So she has to keep removing the milk. Milk stasis, or milk staying in the breast, in a breast with mastitis, is going to cause more problems.
Yes.
So we want to remove the milk regularly. Is it going to potentially be painful? Yes.
Right.
We're going to continue to treat mastitis also with cool compresses. Sometimes when a mom has mastitis, she might need a little bit of a warm compress just to soften a little bit to kind of help get the milk out, but otherwise cool for inflammation. So frequent feeding of the baby on that side. Another trick is to breastfeed the baby in different positions. So it's not uncommon for mastitis to be caused by like a plugged duct.
Right.
And so depending on how the baby is positioned at the breast, that's the area that the baby kind of empties from the breast. So wherever the chin is on the breast on the opposite side of it is getting drained. So if we put if we can kind of identify where that plug might be, or whatever the source of that infection might be, and we position the infant in a way that it's going to empty the breast in certain quadrants, if you will, then that can help as well. But definitely, I don't recommend extra pumping. We don't want to pump the breast empty, because again, that's that feedback that tells the body, ooh, make more milk. And in the instance of mastitis, we just want to normalize what's going on with the breast. And by pumping, again, we're going to cause problems. And that includes Haka. Even a Haka is going to be stimulating for the breast. And that's kind of a new-ish tool that moms will use to collect milk.
Right. One of those, you're referring to one of the little handheld pumps.
Yeah, silicone cup type things. Yeah.
Yeah. And I know because one, I'm a dad, and two, I'm in the field, right? But if for first time, what the heck is a Haka?
Yeah.
There's like a little handheld pump you can use.
Yeah.
It's really convenient in certain situations, but not all the time. But that's a very common question. I have mastitis. Can I breastfeed, or should I pump and dump? Please don't pump and dump. Breastfeed right through. It's really important. Just do what you normally would do. The only additive with the engorgement, you treat them almost the same. Yeah. You just add the antibiotics, and that's important because, like you mentioned, it can get worse. You can develop an abscess or something, and that's not a road that you want to go down.
Definitely not. And to just touch on your comment about pump and dump, never pump and dump.
Please don't.
Don't ever pump and dump. You pump if you have questions. Save your milk until you've decided that it's not safe. But there are very few instances that a mom would actually need to pump and dump.
Right. I agree. It's a very common question. And even antenatally, or, when the patient's still pregnant, again, sorry, I'm used to using these fancy terms sometimes, but when the patient's still pregnant, so many questions like, is this safe for baby? Is this safe for baby? There are so few drugs that are actually contraindicated. Another fancy word, but
not
that means
advisable.
Not advisable. You can't use in pregnancy or breastfeeding. There's so few drugs.
Yeah.
And we will make it very clear, but even still, a very small amount of these medications get into the mom's bloodstream, and even a smaller percentage into the breast milk. Most things are safe, and we will advise you when they're not.
Absolutely.
Yeah, so don't stress about that.
Absolutely.
Yeah.
I think that it's important for moms to know that it gets easier, and the hardest part of breastfeeding is learning how to breastfeed.
Right.
And these are two people learning how to breastfeed. It's both mom and baby. So even for experienced moms, each baby is different. And so that baby is still going to be learning. And so realistically, the best course of action is patience and perseverance, and to keep on trying, and it will usually get better. If baby's not latching, give the baby time. If you're having pain, seek help. If you have questions or concerns, there's a lot of resources available, more and more so all of the time, so that people can get the information that they really need, or the support that they really need. I think it's also important to think about when we talk about how long a mom should breastfeed their baby, and we say 6 months or up to a year or 2 or even 3. What that looks like is you start when you're breastfeeding a newborn. You're not breastfeeding a toddler, and you work up to that stage. And breastfeeding a toddler is completely different than breastfeeding a newborn baby. So in the beginning, it's 1 day at a time, and you just learn how to, parent and breastfeed with your baby, and knowing that it will get easier. And once everybody knows what they're doing, your breast milk supply is established, then it gets significantly easier, and it gets easier to be modest. A lot of moms, are modest, and they don't want to be out there just openly breastfeeding their baby. But once everything is going well, you can simply breastfeed under a cover, and it's super easy. It's not that you have to see where everything is and what is going on underneath that cover.
Yeah, perfect. And, society is becoming a lot more open to it. Obviously, there's a lot of, breastfeeding safe rooms, and you see it everywhere you go, which is amazing. And,
it is amazing.
We need to normalize this, and it's really encouraged.
It is encouraged.
Super, super important.
And we really need to support our moms that need to go back to work. They're the most challenged to breastfeed exclusively for the longest amount of time.
Right. Well, again, thank you so much for being here.
Thank you so much for having me.
I think all of this information is super vital, especially for new moms. If you were a first-time mom and you had this cool platform that you were watching, is there something that you wish you could have seen, that you didn't know the first time you breastfed? Is there something that you could leave them with?
Oh, wow. I mean, it's been so long since I had kids.
I know. Or even in your current practice, you see first-time moms, they're struggling a lot, right? Or they have so many questions, they feel defeated. Like, what is one little piece of advice you think you would want to give, or that would be important for them?
Ooh, on the spot. I would say don't be afraid to ask for help from family and friends. And the kind of help that you need from them is support for yourself. We want to encourage moms to be the care providers of the infant. We don't necessarily want your help to come and just take over the baby. We want to empower moms to be taking care of that baby. And in that way, we want to support the mother. And if she needs help, that might mean a lot of different things for different families, but providing food, providing, cleaning and laundry and grocery shopping and some of those simple things. I think it's okay to reach out for help if you're having problems. It doesn't mean that you're failing at anything. And a lot of times I think moms have a hard time reaching out for help because they feel like this should come naturally to me. I just have this baby. Why isn't this come naturally to me?
And it doesn't.
And then additionally, like if you have any signs and symptoms of depression, you really need to get with your healthcare provider and discuss your options, and just to determine, what is normal within a normal scope of depression for you during your postpartum period.
Right. Absolutely. I'm so glad you mentioned that. listen, pregnancy and the postpartum period, so many things change, right?
Yeah.
Especially, it happens for every pregnancy, but really I say for first-time moms because it's all so new, right? So many things change literally overnight. Your hormones are all over the place. The hormones of pregnancy are coming down after you deliver, right? You're expected to now take care of another human being. Maybe your partner, wife, husband, whatever it is, goes back to work.
Yes.
Your social status changes completely. Probably your financial status changes completely. You have to take care of this little baby. You have no clue what you're doing, or you feel like you have no clue what you're doing.
Right.
In addition to all these bodily changes, and you just feel lost. Having postpartum blues is so normal. It happens pretty often, but there's a fine line to where it becomes postpartum depression.
Right.
If it lasts for maybe more than 2 weeks, or if the symptoms are so bad that they're interfering with your ability to just carry out daily functions, please, please, please reach out for help. There's so many people around you willing to help. I promise you. You feel maybe like there's not and you're alone, but you are not. We're always there. So I'm glad you mentioned that, because that's, something to touch on. You're going to be tired postpartum.
Exhaustion is real.
Exhaustion is real. So you may just have symptoms from that, but when you feel like there's a problem, it never hurts to ask for help. Well, again, thank you for coming on the podcast.
Absolutely.
All super important information. Where can we find you if patients wanted to ask you some questions?
Absolutely. I have a website. My business is called Flower Child Birth and Breastfeeding, and that's the same for my website. And they can certainly reach out to me there.
All right, perfect.